Working from home during COVID-19 is, in some cases, proving to be more stressful than working in the front lines. And the situation is worse for women. A recent study by the National University Health System showed that more than half of women working at home felt stress, compared to around 45% of men. Chloe Chu tells us why.
31-year-old Candy Lee found herself transitioning from a full-time sales supervisor to a full-time work-from-home mother for about 3 months during the circuit breaker period.
I'm just not used to, staying at home the whole day with my son and taking care of him from the whole day. So it was difficult. And then at the same time, work still has to go on. So there are still a lot of meetings. I do think that maybe they can give us more allowance in terms of work assignment, because as you can see, we really do need more time to get our work done because of this taking care of kids issue. We have to work late into the evening.
And she's not alone. Other mothers CNA spoke to say they were more stressed at home due to family commitments. It was also challenging to draw clear boundaries to maintain work-life balance. This led to a more stressed experience at home than in the workplace for both men and women. Survey results showed that more than 60% of those working from home felt this way, compared to around half of frontliners. One expert says this could be due to frontline workers being more familiar with the coronavirus now.
Jobs that are essential but not front-facing are required to work from home to provide business continuity for their organization and company. And they do similarly need to make major adjustments. And in many ways, these major adjustments are made at the individual home-based front. And sometimes it's more than what an individual is likely to be familiar with. The relative lack of IT software support or even hardware support that many home-based workers actually experience is a frequent feedback and observation that we have made.
But there seems to be a silver lining as employers ramp up efforts to help workers stay mentally strong during this period. Around half of respondents say they got adequate support from peers and colleagues. One company says such measures, from sessions where employees learn to manage anxiety to fitness classes, were already in place before COVID-19. But the entire pandemic accelerated the process.
We actually ran a survey at UOB. We found that 69% of the people are actually worried about their jobs. We are very open in addressing some of the top-of-mind questions that they have. What's going to happen to my job? What's going to happen to my salary, and so on and so forth. And we actually told many staff that it is our priority to protect jobs as long as possible.
UOB employee Richard So is still working from home. Although this allows him to spend more time with family, he still misses working with his colleagues and is constantly finding new ways to engage them.
I'm taking charge of the UOB running club. So before the COVID, we used to run weekly, in groups. Now we can't do that anymore. So we'll do a virtual run. So every Wednesday, I will do my run. Then I'll encourage my running club members, to post their running club groups timing and also their photos, to share together to encourage the rest of us to continue exercising and also to stay healthy as well. So we also have quite a number of those virtual activities like yoga, those workout, and even baking to keep the spirits up.